How does genotype affect antiviral treatment for liver illness? Imagine trying to solve a puzzle where each piece is different depending on the person you're helping. That's what doctors face when treating liver infections caused by viruses like hepatitis B and hepatitis C. The virus's genotype, which is like its genetic fingerprint, plays a big role in how well treatments work and how the disease might progress. Let's start with hepatitis B virus. It has several genotypes labeled from A to J. Each one is more common in different parts of the world and can influence how serious the infection becomes. For example, genotype C is often linked with a higher chance of developing liver problems like cirrhosis and liver cancer. Compared to genotype B, it also tends to respond less well to interferon-based treatments, which are some of the older therapies used for hepatitis B. On the other hand, genotype A usually shows better responses to antiviral medications. Sometimes, the virus mutates, leading to drug resistance, which makes treatment more complicated. That's why analyzing the virus's genotype and mutations helps doctors choose the most effective therapy for each patient. Now, looking at hepatitis C virus, which has genotypes numbered from 1 to 6. These genotypes also influence how well antiviral drugs work. Genotype 3 is known for causing faster liver damage and a higher risk of developing liver cancer. It's also associated with increased fat buildup in the liver, which worsens liver health. Even after successful treatment with direct-acting antivirals, patients with genotype 3 may still have a higher chance of ongoing liver problems. Some genotypes can develop resistance mutations that make certain drugs less effective. Testing for these mutations before starting treatment helps doctors pick the right combination of medications and determine how long therapy should last. Understanding the genotype isn't just about choosing the right drugs. It also helps predict how the disease might progress and whether the patient is at higher risk of complications like liver cancer. For example, patients with hepatitis B genotype C or hepatitis C genotype 3 often need closer monitoring and sometimes more aggressive treatment to prevent serious outcomes. This personalized approach, based on the virus's genetic makeup, improves the chances of clearing the infection and protecting liver health. In summary, knowing the virus's genotype is a key part of managing liver infections. It guides doctors in selecting the best treatment options, helps predict disease progression, and addresses potential drug resistance. This personalized strategy is essential for achieving the best possible outcomes and reducing the risk of liver cancer. Always remember, if you or someone you know has a liver infection, consulting a healthcare professional for testing and tailored treatment is the safest way to go.